singer of NSYNC fame and my mother have something in common. Bass announced a few years ago that he had been diagnosed with psoriatic arthritis. His joints ached and were swollen. And he said, "I'm a dancer, and for a long time I just thought the pain was from dancing." He knew he was in pain, but he didn't know what was causing it, so he just brushed it off. My mother was diagnosed with this condition 2 years ago. Like Bass, she had had pain for several years before she was diagnosed. She just chalked it up to her very busy work and family life. Watching her live with this condition encouraged me to learn more about it. Today, I will share information with you to educate you about a disease that might affect you or someone you know. First, we will discuss what this condition is and what causes it. Then we will look at the symptoms and diagnosis. Finally, we will look at the treatment options. Let's start by talking about what it is and what causes it. Psoriatic arthritis is a chronic inflammatory disease that affects the skin and joints. It causes pain and disability in patients. It is a complex condition that is associated with psoriasis. Psoriasis is a skin condition characterized by red scaly patches on the skin. Psoriasis is linked to several coexisting conditions. The most common is psoriatic arthritis, which develops in up to 30% of patients who have psoriasis. The exact cause of psoriatic arthritis is unknown, but it's believed to be a combination of genetic and environmental factors. Genes have been identified that increase the risk of having this condition. Researcher Frank Nestle writes, "Population studies clearly indicate that the incidence of psoriatic arthritis is greater among first and second degree relatives of patients than among the general population." Other environmental risk factors for psoriatic arthritis include obesity, finger and toenail disease, or lesions at sites of trauma. We just discussed what psoriatic arthritis is and what causes it. Next, let's look at the symptoms and how it's diagnosed. Psoriatic arthritis shares many symptoms with other forms of arthritis, such as rheumatoid arthritis and gout. Because of this, it is often misdiagnosed. Most common symptoms are joint pain, stiffness, and swelling. Any joint on the body can be affected, including the fingers, toes, knees, and spine. Patients may also experience pitting in the finger or toenails. Daphne Gladman, a leading researcher in the field, exclaims, "Clinical representations are complex and varied and include peripheral arthritis as well as skin and nail manifestations. There is no definitive test for psoriatic arthritis, and the primary method used to diagnose it is ruling out other conditions that share the same symptoms." We just talked about the symptoms and diagnosis. Finally, let's look at some of the treatment options for psoriatic arthritis. The primary goal of treatment is to reduce pain and inflammation and to prevent joint damage. There are several medications available to manage symptoms. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, are often the first line of treatment, as they can help relieve pain and reduce inflammation. An example of this would be ibuprofen, commonly known as Motrin. In more severe cases, disease-modifying anti-rheumatic drugs, or DMARDs, may be prescribed to protect the joints. Rinvoq is a popular DMARD. Then this is what my mother takes. There are also biological drugs that work with the immune system that have been used with limited results. Lifestyle modifications can help manage symptoms. Regular exercise and maintaining a healthy weight are recommended. Of course, quitting smoking is key to managing symptoms as well. In conclusion, we talked about what psoriatic arthritis is and what causes it. Then, we looked at symptoms and how it's diagnosed. Finally, we discussed treatment options. Now you know the symptoms we discussed today can be more than just a busy lifestyle or 90s pop dancing. It could be psoriatic arthritis.